and the senator, he's used to like being asked questions.
Of course. 9:25. Let's keep it in the KUAM News Zoom room, shall we? And head over to Mooning now, the Guam Memorial Hospital. Standing by, we have William Kando of GMH. Good morning, Mr. K.
Good morning, Bree. Good morning, Chris.
Good morning. So you got your second dose, right?
I got my second dose, so I'm ready for the cross-examination.
Any adverse effects?
No adverse effects. I on a second dose, I did experience like a mild fever, very mild. Took a couple of Tylenol, and I was good.
What about the interest in the employees over there at GMH that didn't take it the first time? Have you seen more and more of the employees there that are interested and stepping up to get vaccinated?
Yeah, as they were watching many of us go through the first and then the second, I guess they felt that they had seen enough. We hadn't grown extra heads or anything like that, and so they developed their own courage. Maybe people in general just don't like needles. I know I don't, but when it comes to this COVID, I'll take the needle any day.
Mm-hmm. There you go.
I'll take that risk over the risk of COVID any day.
What's going on? Can we just get a census update while we have you here?
Sure. As of 8 o'clock this morning, we're looking at total COVID census of 8. We have a total census in the House of 120. So total non-COVID census is 112. So our non-COVID census continues to creep up a little as the weeks go by. It's fluctuating, but that's something that we don't mind creeping up a little higher as the non-COVID census, because a lot of times it's people that had postponed treatment for a long time, and they're finally able to come in, and we're able to help them resolve their issues. Even on the elective surgery side, we have increased our surgeries a bit, and we're trying to open that up a little, especially for those surgeries that cannot wait any longer. And so, yeah, we're continuing to. But the good news is the COVID remains low and stable. And it's definitely because obviously the Guam has kept the CAR score low at 1.3, and so the people of Guam they've done their part. They continue to do their part, and of course they're getting vaccinated now. Probably not as fast as we would all like them. We're definitely restricted ourselves, and public health is restricted in how they're able to implement this vaccine plan because they only get a certain allotment per month. We all saw that in the presentation that transpired, the town hall meeting that transpired yesterday. And so I thought that was really a good town hall meeting to get the word out how we're doing with the vaccine plan implementation.
Right.
So and really good questions that were posed by the people out there.
Bill, so with the COVID census so low, does that mean that some of the COVID care units and wards that you guys had set up for to deal with that crazy surge, have you dialed back some of those units and maybe turned them back into places where non-COVID patients can be treated?
That's correct. I mean, as the non-COVID census goes up, they get repositioned to those areas. They're also helping out with our vaccine plan implementation. So that's really important. We've added some of our nurses to that area so that we can keep the line going through. And then we those opportunities that we get to put them on leave as well. We're putting them on leave, so that they can get rejuvenated.
Yeah. Has there been any changes to the visitation policy?
No, not at this time. Although, because we were the past several weeks, we started, besides our own employees vaccinating them, we started vaccinating their family members. At first it was 75 and above, and then it was then we transitioned in accordance with public health's plan. We transitioned to 60 and above, and so I guess you could consider them visitors because they're coming into the hospital, but we don't let them go into the units still. They come in, they get vaccinated, and then they have to go away because we're still trying to prevent that spread. So we're just still trying to do our part. As a matter of fact, as of this week, we're not doing 60 and above for the family members. We stopped that this week because this week is our next wave to, and we only have enough vaccines to do those employees that need their second dose. So we already did one wave, and now this is the second wave. Once we get past this week, we basically would have given pretty much the second doses to our employees. So next week, we hope to be able to transition and continue to help public health by doing other GovGuam frontliners, and this is what JQ was talking about earlier. We can't do any of them this week because we only have enough vaccine. It's being restricted by the plan. Public health only gets so many vaccines, so we cannot afford to have our employees miss that second dose. It would be a waste. We just can't miss that timeline. And of course, there's a little leeway in there where if they didn't come exactly 21 days later for the Pfizer, they can come, like within 4 days after that date. But we really want to. We're setting up appointments, scheduling so that we can get through this wave as quickly as possible, so we can transition to continuing help others get vaccinated.
I'm sorry, did you say family members of the hospital frontliners were getting vaccinated? Is that what you said?
We opened it up to as far when public health asked our help to do 75 and above, we focused on our family members that were 75 and above, and then it was family members 60 and above.
Right, of hospital workers. Right.
Yes.
Yeah.
Yes.
Okay.
Yes.
Can you give any updates on the assessments for the skilled nursing unit?
They're still at Catholic Social Services. We are in the process of designing at our skilled nursing facility building. We're in the process of designing the isolation of the B wing, and so we're heading towards 100% design submittal, so that we can then enter into a construction phase, so that we could have more flexibility with that building. So then we would be able to bring back the residents to that B wing, and the facility would still be in a state of readiness, the A and C wings, in case Guam experienced another surge coming up. Right. And so yes, we're in that process. But for now, until we get there, the residents are still at the Catholic Social Services. Mm-hmm. If there was an event like a typhoon, knock on wood, I'm not asking for any typhoons, because we got our hands full. But if we had something like that, and we still haven't done that project, we would likely bring those folks back to the hospital, and we would strategically place them within the hospital as long as our census is low, because we cannot leave them at that facility. We wouldn't be able to feed them during a typhoon, and they don't have typhoon shutters over there, so it's a concern for us. We have to maintain the safety of those residents.
Right. Was the contract ever signed?
No, the contract is still sitting, I believe, at the AG's office. I guess they had issues with it, or still have issues with it, but we're looking. We may try to enter into some different form of agreement with them, just to get past this. Yeah.
Can you
Yeah.
provide an update on
Not much change there.
the travel nurses, Bill?
As far as the travel nurses go, we're still in the process now of working with our travel agencies, New West and Medical Solutions, to bring in replacements as our travel nurses that were scheduled to, a certain time frame, as their time comes to an end. We're bringing in replacements to keep ourselves at a certain level of staffing, not only for our current census, but a little cushion just in case we have another surge.
What about any update on structural repairs that may have been made? I know the Army Corps did some work.
Right, and they were doing more work, I think.
They did complete that work. They completed all their work on the project that we had contracted, that FEMA had approved contracting the Army Corps. This was for care units, electrical upgrades and negative pressure upgrades to care units 3 and 4, which is our former pediatrics unit and our former telemetry unit. So that work has all been completed. We were trying to get them to also FEMA to consider doing an electrical upgrade to our care unit number 2, but they're not. I don't believe that's going to be approved. So we will likely try to do that locally ourselves without them, since we already have the design in hand. We will still continue to try to do that project.
Have the tents come down?
No, the Blue Med tent is still back there. We're still providing very minimal amounts of therapeutic treatments out there in the back, behind the ED. The bamlanivimab. I may be one of the few folks that doesn't have a problem saying that word.
No. Bamlanivimab.
Bamlanivimab. You gotta say it like you're singing it. Bamlanivimab. Bum, bum, bum.
So that one, the remdesivir, the convalescent plasma, we're still doing that, but I think possibly more of that kind of treatment is being done away from the hospital, which is good because our focus back there is ER admissions.
All right. Thanks, William.
No more
Anything
questions.
else?
No further
I mean,
questions.
I could follow up on
Go
some
ahead.
other stuff, but
Yeah.
so how many patients are at Catholic Social Services?
As of 8 o'clock this morning, we have 8.
Okay. And so
Over there.
how much are we paying Catholic Social Services? And is this a monthly, month-to-month type of agreement?
Yes, it's a monthly rental. It's about 10,000 a month, which is, for that service and for that opportunity to keep them safe from COVID. That's pretty reasonable.
Right. And so do we also pay for the food to be delivered there?
Yes, we make the food and we deliver it there because they're on special diet.
Right. Mm-hmm. Have you? So what seems to be the problem with the contract at the AG's office?
They're busy suing Google. They don't have time to look over anything because there's.
I guess they're just not satisfied with the way it was structured, and that's fine. We'll see if we can figure out what Plan B is going to be. Hopefully, our best. We really want to just bring them out of there as soon as possible. That's our primary goal. But in the meantime, we're just happy that they're safe.
Yeah.
They've been isolated, and they've been vaccinated.
Mm-hmm, mm-hmm. So what's the timeline then to get the renovations underway over at the SNU?
We should be completing this design within the next few weeks. Then we'll quickly enter into a into a construction phase. Yeah, it's a little tricky. I'm not really. I wouldn't feel comfortable saying how long it will take because, it would still have to go through a bid process, a procurement process, and in the submittal, the final submittal by the designer, they will give us a schedule, a projected schedule. They'll give us a cost estimate, so we'll know more details on that soon.
All right. Thanks a lot. I don't. No further questions.
Thanks, Bree.
The witness may leave.
Thanks,
us.
Chris.
Thank you, Bill.
Stay safe.
So how long is Lillian going to
You
be
guys
gone? How long is Lillian going to be gone?
She'll be gone till early February.
Okay.
So yeah, she's going to Taiwan with the flight today?
She is going to Taiwan.
So what's she going to
But I'm really happy. We're really happy that she's getting some time off because we're all going to take our turns. Taking some time off. For me, I haven't taken any time off in years. I can't remember the last time I had a vacation. So I'm
time off.
I'm really happy that. I'm sorry.
So she's going on vacation?
Well, anytime away from the hospital is restful, and we told her to stay away from the chat and stay away from the emails.
That's hard to do.
Yeah, I already chatted her up twice this morning. My bad.
She's gonna block you.
Yeah, she'll block me.
Temporarily block Chris Barnett.
All right. So you're the man then. While she's gone, we'll be able to get a hold of you.
Do we have his number?
We don't have his number.
Oh.
Yes, myself and Dr. Badaya, we're holding the fort, but we're happy to hold that fort.
Can you get with Jason in the Zoom chat? I think he asked you a question before we let you go.
I have to. Well, I gotta get over to the airport
Right.
by 10 because I'm gonna be participating in that
Right on.
Taiwan that